BBC Radio Norfolk 7:35. The Prime Minister's announcement of a roadmap out of the coronavirus lockdown has prompted more questions than answers in many people's minds. For us in Norfolk, the questions of how to judge the boundaries of what can and can't be done are far from clear. So far, 324 people have died from the disease in Norfolk's hospitals since the start of the outbreak, with the highest number at the Queen Elizabeth Hospital in King's Lynn, where 123 people have died. Many businesses, though, are warning they may not survive unless restrictions are eased. Let's talk to the North West Norfolk MP, James Wild, who is on the line now. Good morning.
Good morning, Chris.
We had your colleague George Freeman on the programme at this time yesterday, and he was saying that his inbox was already full with questions from people who live in Norfolk who were confused about the advice, who wanted more information about where they stood. Has your inbox been like that as well?
There was certainly a lot of emails on Monday morning, but I think what we've seen since then is a whole plethora of guidance that's been issued. The full plan has been published, the very helpful "what can I do from Wednesday, what can't I do" document, as well as lots of guidance for workplaces so that people can keep safe. So I think there was naturally a lot of questions. I think many of them have been answered. There's always going to be some that haven't been answered, but in the segment you went through earlier, I think you had a lot of the answers on golf and schools and grandparents. So I think the information is out there, but we all have to apply a bit of judgment here. There's not a full manual. We've got a bit of responsibility ourselves.
Is this really the right time to be easing restrictions? We are still seeing new hospital admissions and still a daily death toll in the hundreds, aren't we?
We are, and I want to pay tribute on International Nurses Day to all the staff, particularly at the Queen Elizabeth Hospital in my constituency, but across Norfolk and the country, who are doing an incredibly humbling job on our behalf. Having gone there to pay tribute to Chrissy Emerson, who very sadly died, I had the opportunity to speak to some of the nurses afterwards, and the toll that it's taking on them shouldn't be understated. But we're in a position now where the R rate, the reproduction rate of the virus, is below 1. It's being controlled, so we can move forward very gradually and in a controlled way to ease some of the restrictions which people have been wanting, not just businesses, but people who've been stuck at home, which is not necessarily great for their mental health and for their well-being. So we're moving on. As you said, it's a roadmap. It's a 3-step plan, and we'll only move forward to further steps if the rate of infection keeps below 1, keeps under control.
We've heard from the leader of North Norfolk District Council a couple of times over the last 24 hours. She's still got a number of concerns, because we know that from tomorrow people will be able to travel as far as they like for exercise. There are worries that it's going to lead to lots and lots of people turning up on the beaches of North Norfolk, and she doesn't know whether to open her car parks again, whether to open the toilets, the public conveniences again, bearing in mind that people will have to clean them and look after them. She still says she doesn't know what to do. What would your advice be to her?
So I share some of the concerns that the advice on travel may attract people to the coast, and my message is clear that we've all got a responsibility here. If we see the kind of scenes that we saw in Hunstanton and Wells and around the coast before the lockdown was imposed, with people not socially distancing, then we'll revert back to the stricter measures. So everyone's got to use their common sense, and if they do come to the coast, they've got to socially distance, keep away from people, not congregate in large groups. In terms of car parks and things, I heard the interview with Sarah. There are a number of questions where there are answers, but she didn't seem to like the answer. On car parks, my local borough is working through the guidance. They'll be taking advice. They'll be talking to other boroughs to try and ensure there's a consistent approach across Norfolk. So my advice for her would be to talk to other boroughs, find out what they're going to do. Ultimately, she is the leader of the council and has to make judgments and take responsibility as well.
But do you think she should open the car parks?
Well, I think what was happening in my area, speaking to the cabinet lead on this, is that they're looking at the guidance to decide what to do, whether to open some of them, whether to open none of them, and that will depend a bit on what other councils are doing as well. So there's going to be some local variance, but I think it's better that people at a local level are deciding this than necessarily someone in Whitehall dictating a blanket approach. And on public conveniences, they've never been told that public conveniences have to close. Again, it's, can you open them safely? Can you do it in a responsible way? Is it better to do that? If not, then take a judgment not to. But local politicians should take local decisions like that.
North Norfolk has a population that is a lot older than the average across when you compare it to the country. It has, by definition, then a lot more people who could be vulnerable in. So these are big decisions that they've got to be got right. And surely just asking for a bit more clarity, a little bit more guidance from government is what they're perfectly entitled to do.
Absolutely, and there's ways in to do that. If there's any specific questions like that, then she should be talking to her MP, Duncan Baker, who can feed them into the communities and local government department, or local councils have their own routes directly in if there are specific questions. But there will be elements here where there's local discretion. And I think that's the right approach for people to take. And Judge, as you say, we're different to other parts of the country. If the government said every car park should be open because that suited some other areas, then we wouldn't be too happy about that. So I do think we can apply our own judgment here. But effectively, everyone has to follow the social distancing guidance. And if you're outside, the risk of the virus being spread is far, far lower, which is why we're moving to this slowly phased greater opportunity to go outdoors, to exercise. Garden centres are open. That's something I've been calling for, which would be great news for people who've been quite frustrated, unable to get plants to do their gardening. And we're encouraging people to go back to work, but to do so safely if they can't work from home. So it's a phased approach. It's giving people a bit more freedom and judgment. And I'm confident that people will use it wisely in Norfolk.
There have been some suggestions that the government's advice over the last couple of days has been deliberately vague to some extent, because if there is a second spike, the government doesn't want to be in a position where it can be blamed for it. It wants to be able to say, well, we handed you the control. We asked you to make your own decisions, and that's why there's a second spike. It's not our fault. What would you say to that?
I don't think that's accurate. I think the Prime Minister, the government will always be judged as to how this pandemic plays out. I don't think there's any sense that it's shifting responsibility and accountability. The government's put forward a very clear roadmap with guidance, and there's a number of questions that have been answered. We can't answer every single question, and people, I think, are able to make a judgment. As if you can go outside and you can be 2 meters away from other people, and you can do whatever you're doing, whether you want to play tennis or do some sport, and you can do it safely, then you should do it. I think the alternative approach is to remain in a very strong, strict lockdown rather than ease the controls. And certainly the view that I've been having from my constituents is that they wanted a bit more flexibility. And I think people are well able to apply their judgment to this situation. If they don't, and people apply it badly, then we'll have to revert back to the tighter controls, which I think we want to all move forward to this pathway to recovery, which has been set out. But it depends on us all doing things. And then obviously there's going to be the test and trace process in place as well, which will help keep the infection rate down.
Thank you for talking to us this morning. North West Norfolk MP James Wilde joining us live on BBC Radio Norfolk. His latest views and the information he's been getting and the questions